If you have been diagnosed with fatty liver or non-alcoholic fatty liver disease, the good news is that it is entirely reversible. In the content of this video, I will detail the specific procedures necessary not only to reverse this condition, but also to do so quickly, allowing you to see transformations within a few weeks. Moreover, I will provide valuable guidance on which foods are essential to include in your diet and which to avoid restoring liver health. In conclusion, we will explore other effective measures to strengthen liver function and discuss the most effective supplements to support recovery and restoration of your liver to a healthy state. Let's get started. To understand the reversal of fatty liver, it's crucial first to discern its causes, which are notably simple. The buildup of fat in the liver often stems from excessive consumption of sugars, particularly fructose and sucrose, with sucrose, or table sugar, breaking down into fructose and glucose in the body. The intake of these sugars triggers a series of biochemical reactions that lead not only to fatty liver, but also to other serious conditions like type 2 diabetes, cardiovascular diseases, certain types of dementia, and a variety of malignant cancers. Fructose is distinguished by not inducing the secretion of leptin, a hormone that normally signals the brain the feeling of fullness after eating. The lack of this signaling with fructose intake facilitates excessive calorie consumption, as the brain does not get the message that the body is satisfied. Furthermore, repeated fructose consumption can lead to leptin resistance, resulting in constant hunger and making it difficult to feel full, which extends to the consumption of other foods and not just those containing fructose. Research, such as one highlighted in the American Journal of Clinical Nutrition, has shown that diets high in fructose can, in just 1 week, significantly increase liver fat accumulation and reduce insulin sensitivity, worsening the risk of metabolic disorders. Now, how do we avoid fructose? Fructose is a sugar found in natural sources such as honey, fruits, and root vegetables. Fructose intake is not problematic. Humans have been consuming fructose for hundreds of thousands of years. However, the problem arises with the increased consumption of refined sugars and high amounts of fructose, which is relatively new in human dietary history. Fruits and vegetables contain fructose, but also have fiber and nutrients like vitamin C, which can mitigate the harmful effects of sugar. Fibers slow down the absorption of fructose, while vitamin C has antioxidant properties that help protect the body against cellular damage. When fructose intake occurs through whole foods like fruits and vegetables, our bodies use the fibers present in these foods to aid in slow absorption and metabolism of fructose. Additionally, dietary fibers help to promote satiety, regulate blood sugar use, and support digestive health. Conversely, fruit juices, while being a concentrated source of vitamins and minerals, also provide a large amount of fructose without the benefit of fibers, which can lead to excessive sugar consumption. Sugary drinks, including fruit juices, sodas, sports drinks, and energy drinks, are particularly problematic because they are consumed quickly and can contain sugar amounts that exceed the daily recommendations of the American Heart Association. For example, a single soda can contain up to 40 grams of sugar, exceeding the daily recommended amount for women. Moreover, the consumption of sports and energy drinks, often endorsed for athletes and active individuals, can be misleading. While they provide essential electrolytes for post-exercise recovery, they can also be a hidden source of excess sugar and unnecessary calories. Dried fruits such as dates, raisins, and plums are another example of foods that, while healthy in their natural form, become highly concentrated in sugar when dehydrated. This can lead to the inadvertent intake of large amounts of fructose, which the liver may have difficulty processing when consumed in excess. Moderation is key, and opting for fresh or frozen fruits over dried ones is preferable for those concerned with liver health. Fatty liver, or hepatic steatosis, can be a precursor to more serious conditions, including liver inflammation and cirrhosis. The condition is reversible with dietary and lifestyle changes, and studies indicate that reducing fructose consumption can have a positive impact. For instance, research published in the Journal of Hepatology showed that dietary changes, including reducing sugar intake and increasing fiber-rich food consumption, can improve liver function and reduce liver fat. Therefore, to reverse fatty liver, it's crucial to avoid excessive sugar consumption and prioritize a balanced diet rich in fibers, proteins, healthy fats, and complex carbohydrates. Including regular physical activity and medical monitoring are also important steps for maintaining liver health. Eat more protein. An effective strategy for combating fatty liver includes increasing protein intake, especially during breakfast or the first meal after waking up. Research, such as one published in the scientific journal Obesity, which examined over 9,000 Australian individuals, highlights the importance of adequate protein intake in the first meal to positively influence the amount of food consumed throughout the day. A breakfast high in protein is associated with lower subsequent caloric intake, while morning meals low in this nutrient tend to lead to increased consumption of high energy density, processed, and sugar-rich foods, precisely those that can exacerbate liver problems. Therefore, if you struggle with a constant craving for sugary or processed foods that are harmful to the liver, it is advisable to increase your protein intake at breakfast. For those who eat 3 times a day, the ideal is to consume between 25 to 35 grams of protein per meal. A diet high in protein can help reduce sugar intake and facilitate weight loss, which is one of the most efficient methods for improving the conditions of a fatty liver. Losing just 5% of body weight can result in significant benefits for fatty liver, while a reduction of 7% can potentially eradicate non-alcoholic steatohepatitis, NASH, a more severe condition related to fatty liver. Moreover, protein plays a crucial role in liver tissue repair and metabolic balance, further strengthening the argument for its regular inclusion in the diet. Avoid saturated fats. As you optimize your protein intake, it's crucial to balance your protein sources with the conscious choice of fats consumed. While meats and dairy products are high in protein, their contribution to saturated fat intake can be concerning. These fats are common in red and processed meats, high-fat dairy products, and various fried and fast food items. Red meat, though a debated subject, can be consumed in moderation, following the premise that moderation is essential in a balanced diet. Research, including a significant study in diabetes and metabolism, indicates that excessive consumption of saturated fats can exacerbate fatty liver accumulation more than fructose. Additionally, results from randomized controlled trials suggest that replacing saturated fats with polyunsaturated fats like sunflower oil may benefit body composition without increasing liver fat. These studies underline the importance of avoiding an excess of saturated fats, which, when consumed above 5% of the daily caloric total, can raise health complication risks. For a healthier choice, polyunsaturated and monounsaturated fats found in fish, nuts, and avocados should be prioritized. Olive oil, for example, is an excellent substitute for saturated oils like coconut or palm oil in diets, especially for those following a ketogenic or low-carb eating plan where fat is the main energy source. In these diets, the quality of fat is of utmost importance to maintain metabolic health and promote effective weight loss. Ketogenic diets have been shown to be a robust strategy for weight reduction and metabolic health improvement, provided they are executed with a higher proportion of healthy fats. However, attention should not only be paid to the quantity, but also to the quality of fats and proteins. It's advisable to include high-quality protein sources that are low in saturated fats such as poultry, fish, legumes, and eggs. Including these sources in the first meal can contribute significantly to satiety and appetite control throughout the day, aiding in weight management and liver health. Conscious eating not only helps maintain a healthy liver, but also contributes to the prevention of chronic diseases such as fatty liver and non-alcoholic steatohepatitis, NASH. Adding dietary fibers from vegetables and whole grains can also favor liver health by promoting satiety and reducing total caloric intake. The balance between proteins, fats, and carbohydrates is the key to a healthy liver and a healthier life. The carbohydrates. Although ketogenic diets have been effective in treating conditions like fatty liver, many find it challenging to maintain the elimination of carbohydrates over the long term. Fortunately, to combat fatty liver, it is not strictly necessary to eliminate carbohydrates, but rather to focus on their quality and type. Foods with a low glycemic index, which release glucose more gradually into the bloodstream, are beneficial for liver health. These include, but are not limited to, fiber-rich legumes, some low-sugar dairy products, non-starchy vegetables, and whole fruits with natural fibers. It's also important to consider the impact of these carbohydrates on weight control and insulin resistance, significant factors in the progression of fatty liver. Therefore, instead of an elimination approach, a strategy of moderation and smart carbohydrate choice is recommended. High glycemic index carbohydrates such as white bread, white rice, most morning cereals, and processed potatoes should be consumed cautiously due to their negative impact on glycemic control and liver health. Replacing these foods with healthier, nutrient, and fiber-rich options can not only help maintain a healthy weight, but also improve lipid profiles, reduce insulin resistance, and contribute to overall liver health. Moreover, adopting a dietary pattern that includes a variety of whole grains such as quinoa and barley can offer additional benefits due to their fiber and phytonutrient content, enhancing healthy liver function and promoting satiety. These dietary changes, along with regular physical activity and stress management, form a holistic approach to the treatment of fatty liver, reduce alcohol, and increase physical activity. To summarize, it's crucial to emphasize that fighting fatty liver disease is not limited to diet. Avoiding alcohol consumption is also essential. Regular practice of moderate-intensity physical activities, achieving at least 150 minutes weekly, and including resistance exercises or weight training twice a week are proven measures to promote liver health. By following the recommendations presented in this video, you can observe an improvement in liver indicators within a few weeks, as the studies discussed demonstrate. Furthermore, starting these practices as soon as possible is vital to prevent the disease's progression to more severe conditions, such as non-alcoholic steatohepatitis, NASH, or fibrosis, which can lead to cirrhosis. In advanced stages of liver disease, when cirrhosis is established, the remaining option may be liver transplantation. Therefore, preventive measures and lifestyle changes are fundamental for maintaining liver health. Additionally, regular monitoring of liver health through blood tests and medical evaluations can assist in the early detection and proper treatment of fatty liver disease. Supplements. When considering the improvement of recovery from fatty liver, in addition to dietary changes with whole foods, one may consider including dietary supplements. It's important to stress that while a proper diet rich in essential nutrients and unprocessed foods is the foundation for treating fatty liver, certain supplements have shown efficacy in scientific studies and can be beneficial to enhance liver recovery. Although supplements are not essential for liver repair, they can provide additional support when used correctly. Supplements like alpha-lipoic acid, silymarin, a component of milk thistle, and curcumin, found in turmeric, have antioxidant and anti-inflammatory properties that can aid in liver health. Others, such as vitamin E and omega-3 fatty acids, have also been linked to improvements in fatty liver. It is crucial, however, to consult a healthcare professional before starting any supplementation to ensure that it is appropriate for your individual needs and does not interfere with existing medications or health conditions. The decision to supplement should be an informed one, complementary to the diet, and not a substitute for a healthy and balanced diet. First, the administration of vitamin E at a dosage of 800 international units daily has been correlated with a notable improvement in patients with non-alcoholic steatohepatitis, surpassing the effect of a placebo in clinical trials. However, it is advisable to discuss any supplementation with a doctor, especially when considering high dosages. Excessive consumption of vitamin E, specifically amounts that exceed 400 international units per day, has been linked, albeit inconsistently, to an increased risk of overall mortality and a higher prevalence of prostate cancer in some studies. For these reasons, vitamin E supplementation tends to be recommended cautiously, and primarily for those with more severe liver diseases. It's essential to balance the potential benefits against the possible risks of high vitamin dosage. Furthermore, periodic assessments may be necessary to monitor overall health and avoid adverse effects. Additionally, vitamin E is a fat-soluble vitamin, and excess can accumulate in the body, which makes the careful management of its intake even more critical. While vitamin E therapy can be promising for the specific condition of steatohepatitis, patients with other health conditions should follow medical guidance for proper supplementation. Second, the inclusion of omega-3 fatty acids in the diet, based on a 2018 meta-analysis in the journal Clinical Nutrition, may be an effective strategy for improving liver health. Fish oil supplements, rich in DHA, have been shown to benefit by reducing liver markers such as ALT and AST and in decreasing hepatic fat accumulation. Additionally, choline, found in foods like eggs, lean meats, and dairy, has shown promising results in recent case control studies, with an association of an 81% reduction in fatty liver in individuals with high intake of these nutrients. While choline supplements are emerging as a potential treatment for fatty liver, it is imperative that more research be done to establish clear benefits beyond the population with choline deficiency and to determine the effective dosage. In the absence of more robust data, obtaining choline through diet is recommended, focusing on foods rich in this nutrient, which includes not only animal-derived products but also vegetarian options like yogurt, sunflower seeds, and cruciferous vegetables, broccoli, cauliflower, and cabbage, all of which also contribute to omega-3 intake if seafood is included in the diet. It should be noted that there are other substances and nutritional approaches to treating fatty liver that have not been addressed in this video, and medical consultation is always advised before starting any supplementation. The information shared here aims to provide a starting point for those looking to improve liver health through nutrition and supplementation. Stay tuned for more informative content, and thank you for watching. We will meet again soon in the next video.